an incidence of 1% as kind of a general global chance of a child having heart disease, in our country, our birth rate is 20. So for every child that's born, we're talking about 2 lakhs of children born per year with congenital heart disease.
So common are cases of children being wheeled in with heart ailments that doctors urge parents to watch out for symptoms like shortness of breath, blue lips, face and nails, low or no weight gain, murmurs or irregular heartbeats. The causes could be chromosomal abnormality, exposure to infections like rubella inside the womb, the expectant mother's exposure to carotene, folic acid deficiency in the expectant mother, or her smoking and drinking during pregnancy. Equally responsible for a rise in heart ailments amongst children is our lifestyle.
Seeing is that the arteries of the heart can have fat deposits as early as 3 years of age. So now we're seeing this kind of acquired or new heart disease or lifestyle heart disease where they don't have heart disease, they don't have rheumatic disease, but because of all the changes of fatty foods and no exercise, they're getting heart disease earlier on in life as young adults.
Eating high quantities of sugar, salts and fats in rich processed and junk foods, and lack of exercise and outdoor activities are 2 of the commonest causes of obesity in children. Obesity that clogs the heart.
Lifestyle corrections, social skills training, personality enhancement, training to deal with stress, these are things that need to start at a younger age, and I do believe school education needs to involve a holistic approach to life rather than just physics, chemistry and maths.
If your child came to you today with a complaint of a pain in his chest, the last place that your mind is likely to go is to that of a heart attack. But you may need to rethink. More and more children today are being affected by this disease.
The key to recovery is timely detection, as in the case of Shruti. Today she can walk along the entire floor of this hospital. Nothing short of a miracle, considering this 11-year-old has never in her life been able to take 10 steps together without turning blue. She has always had to move cautiously, always afraid of yet another attack of breathlessness.
बचपन से ये जब 3-4 महीने की थी तो रोती थी। वो रोने के बाद इसके होठ, वो नखे के पीछे, वो पंखुड़ियों में ऐसा नीला कलर आता था, नीला सापन आता था।
Shruti was a blue baby, which means when active, stressed or discomforted, her complexion turned blue from the lack of oxygen in the blood. She had a congenital defect of the heart. Once the parents realized this was not a passing illness, they started looking for treatment. Most doctors they met said she could not be cured. Super speciality hospitals in cities prove prohibitively expensive. They're almost given up hope when they learnt about the philanthropic initiatives at private hospitals. Shruti had to be admitted immediately. Without a surgery, doctors said she would not survive much longer.
We should have seen her before the surgery. Her nails and fingers were black almost. And essentially the surgery is correction of the defects that she had. So we closed the hole, we opened up the passage from the heart to the lungs. That restores the circulation to normal. And now she's pink and she's getting up. So it's a dramatic difference. So it's a blue to pink surgery.
In another ward across the city, Jitender's parents are waiting outside the operation theatre where a team of doctors is performing a 4-hour heart surgery on their 2-year-old. His ailment was fortunately discovered early during a government health screening drive for newborns. Now, hours are going by in tears and prayers.
प्रॉब्लम तो यही है, हार्ट का जो दिल में छेद है। इसमें 2 बताते थे, जो हमने इसका टेस्ट कराया 2 बताते थे। अब हम पे तो इतना आता नहीं है जो हम देख लें, पर हम उनकी बात का यकीन कर चुके थे।
Like Shruti, Jitendra too has received a sponsored surgery. One of the multiple initiatives that private hospitals are creating to reach out cardiac care to the underprivileged.
Little Hearts program is a program we've tied up with the Being Human Foundation, which is Salman Khan's foundation. And so far in the 15 months that we've been operating, we've operated 500 children.
Given the dangerous proportions of cardiac ailments amongst children, the International Pediatrics Association that earlier prescribed that children must be screened for heart diseases by the age of 10, last year brought the age down to 8.
I believe that an echocardiogram should be done at some point of life in the first 4 to 5 years in every child. Every child. It's just a simple external investigation. It costs little and yet could pick up heart disease, which we pick up much later on in life. Many of these don't need to be treated surgically even at that time.
Cases in which a child's heart is beyond repair, a transplant becomes necessary. The process is difficult. To begin with, it's a transplant on an infant. Then there are complexities of finding a match.
One heart transplant, yes, is dependent upon another child or newborn dying, and so it's, you can only get a heart from another person of the same size and weight who has died. Plus, then the longevity of the heart transplant recipient also is not that good. And when you're looking at a child, you need to give a child a 50, 60, 70-year lifespan, and that's not really possible even with the heart transplants.
The other challenge is shocking. We have only 30 good pediatric cardiology surgeons in the country. Place this against the demand. 2 lakh new cases, about 1.2 lakh of which need surgeries each year, which means regular cardiologists end up performing pediatric surgeries.
Many of these diseases and also the valve stenosis, which doesn't lead to cyanosis, are being taken care of by cardiologists by means of intervention cardiology. They are closing the holes or taking care of the valves percutaneously without opening the chest. But when it comes to cyanotic babies, yes, they require a complex surgeries, and these facilities may not be available.
We're short of regular doctors, forget specialists. Our lifestyles are dangerously unhealthy. Our children are easy victims.